Okay, can you tell us your name?
My name is Betsy Wolfson.
Okay, Betsy. So, what brought you into our office originally anyway?
My daughter and my son-in-law were coming to you for chiropractic services, and I just moved here,
Ah,
so I needed to find a new chiropractor.
okay. And what was your experience when you came in?
Well, it's a different experience that I experienced before, but the adjustments are certainly helping my pain level. And at the same time, I found out that you're an Ayurvedic physician, and I did some research on it. I think it's the right time and the right place for me to make a commitment to feel better.
So that when you came in, you told me you have multiple conditions like high blood pressure,
Mm-hmm.
high cholesterol, diabetes, and arthritis.
Mm-hmm.
Uh, what has been your overall experience since you've been doing this?
Well, I'm doing it gradually for me because it's a tremendous change in my habit.
Right.
But what I've noticed more is I'm taking more time to take care of myself with these products.
Good.
Not having as much anxiety, and during this COVID virus, that's a big thing for me. Normally I would have panic attacks or go into a depression. I haven't done that. I also, generally, my energy is building up. I'm able to stay on my feet, to do a little bit more. I was in a really bad place. And as I'm gradually doing the suggestions, that you have gave me, and changing to organic food and cooking differently, I absolutely feel better all around.
Now, I remember one day you came in and asked me for, you saw that we had some spices. But you said when you use the spices, you noticed something in your legs.
I felt the pins and needles go away.
Ah, okay.
At first I started doing it twice a day. Now I'm spending time taking care of myself. So if I notice that, that little discomfort comes back, within minutes, that pain is gone.
Wonderful.
I'm committed at this point, and I feel it helping. The arthritis is better. My heart rate is better. I don't have as much shortness of breath as I had before.
Wow, good.
I can genuinely feel it. And trust me, I was a foodie. That was like my instant gratification.
Right.
I would say now my energy is...
You said something about your glucose the other day?
My sugar was normally like 160, 170, even with the insulin and the medication I was taking. Now it's down to like 129,
Wow.
130. I'm not taking as much insulin as I took before.
Excellent.
So I was a pasta lover. I really, really miss pasta. So I made myself some. Oh my gosh. I'm telling you, that night I had reflux like nobody's business. And
but you've been able to integrate the dietary things pretty good?
Yes, but I'm doing it slowly.
Yes.
And my goal is to get off the pharmaceuticals, and I think I'm heading in the right direction.
Wonderful.
I feel like I am.
And then what about your knees? You told me that your knees were really bad. And tell me about what we did for your knees and what that effect was.
Well, I had surgery on my knee April of last year, and I was released from the orthopedic surgeon, but I was still having pain. I have arthritis in that knee, but I can't take arthritis medicine.
Right.
Because I only have 1.5 kidneys. Well, I'm using, I think, 4 or 5 of your creams: Flexible Flow, BioQ10, Cell Cleaner,
So you clean.
Bone Herb, And there's
fascia
more.
nutrition.
And fascia nutrition. And it's simple. It doesn't take any time to do when you wake up or when you go to sleep. And when I wake up in the morning, there's not as much stiffness and not as much pain. And thank goodness, because if I was continuing to have pain, the orthopedic was going to give me a knee replacement.
So your pain is less since you've been using those?
Oh, much less. And when I get it, it just takes minutes.
Oh, you mean once you apply the cream?
Once I apply it.
Oh, excellent. Excellent. So you notice an immediate difference after you do it?
Within minutes, yes.
So there was one other symptom that you mentioned, which was constipation. Can you tell me about that one?
Well, I have been constipated probably for 35 years, and I've gone through over-the-counter things to help me, Miralax, Ducalax, and it's just very hard. I actually had to write on the calendar when I went to the bathroom because I'd feel all bloated and terrible.
How frequently were you able to have?
Once a week.
Oh, once a week you would have a bowel movement?
Once a week.
Okay, and since you've been doing this program, how has that changed it?
Well, I'll tell you, I don't go every day, but I did what you told me to do, which is sit and try to make a time.
Right.
But I'm going every other day.
So you're having bowel movements like 3-4 times a week rather than once a week.
Right. And I feel different from that. I mean, as soon as I go to the bathroom, it's like, oh.
Yes. And is it easier, is smoother, easier kind of bowel movement?
It is getting easier. You know, I'm not 100% there yet, but it's coming on its own, you know, and and when I feel it, I stop what I'm doing and say, hey, yay, I went to the bathroom.
Very good, very good. Okay, congratulations. It's a big achievement to do that, right? Okay,
it is.
Thank you. Take care.